everyone. My name is Dr. Taiye-Opatewa. I am a medical doctor trained in Ukraine and also licensed in Nigeria. I'm also a passionate health educator. I love to encourage persons in their general growth and well-being. I'm here to talk about bronchitis. So stay tuned.
Having with us today a doctor, and she'll be discussing on body odor. Yes, you heard me right. Body odor. It's a big challenge, not just to the people around the person suffering from this, but to the individual himself. So we're going to be talking about the mental health of this individual. We're going to be talking about the relationships. We're going to be talking about how body odor happens, what causes it, and how you can manage body odor. You can imagine having to share the same office space with someone that has body odor, as in a serious body. Awesome. So you're welcome to our podcast today.
Thank you.
Something of grave concern on my mind is body odor. The problem with blessing is a big problem. Like, imagine being in the same space with someone that releases this kind of thing, the strong one. I think there are different stages. In fact, there are different grades, different levels of body odor. So, in fact, I've heard so many stories. Some people will say, if I use deodorants, it will increase it. Some people say, no, if I use this one, it will reduce it. So, that's why we really want to know how to manage. But we want to know what body odor is, how people get body odor. Is it through food? Is it through, we just want to know what body odor is all about. Can you tell us, please, before we even go into the solution part, let's just know what is body odor.
Okay, so this question is very, very important because a lot of people are going through this, have this difficulty, and a lot of the way out, as I said. But the medical term for body odor is bronchitis.
Okay.
What's it called? Bronchitis.
Okay.
But it's essentially an unpleasant odor that is caused by various factors, from diet to poor hygiene, to bacteria on skin, to certain medications as well. So all these factors can cause one to have bronchitis. And the funny thing is, bronchitis can also be inherited. So there's a particular, it could be, it's called, the medical term is a metabolic disorder, where some products cannot be completely broken down by the person's body. Doesn't make sense. I don't want to make it so.
So that it should be easy to understand. Right?
So in such cases, they will need to medically attended to have further checkups and all that. So.
The serious matter.
Lots of things.
Wow.
Lots of things. Yeah.
Okay, so it means there are some underlying medical conditions to it from what you just said.
Yes. But usually, I would always advise that you do the general check first. The general measures, which are, we're not going to treatment, right? But before you start thinking that the reason why you're having body odor is because you have a medical condition, let's start with hygiene. Let's start with
exactly.
And let's see, that one cannot tackle it, then you can now say, okay, let's think about the other.
Okay. Okay, that makes sense. So, but why is it that some people have stronger body odor than others? First of all, I beg, is it that everybody has body odor? Because I've heard some people say, please, madam, everybody they smell. So is it true that everybody smells? In what way?
I know odor is an unpleasant smell.
Okay.
So I would not say everybody has body odor. Okay, maybe, but I would say that everybody emits a smell from their body, right?
Okay.
So it now be, as you said, different factors could play out in making someone's body offensive.
Yeah.
Diets, right? That's a major factor, because someone who is consuming alcohol, you will notice that those people have body odor, right? Someone who maybe is even diabetic, right? Because they excrete something called ketones. These ketones can come out in breath, can come out in sweat, can come out in urine, and then it comes out with a certain scent. And we will now perceive it as there's a smell of this particular person's always emitting, and other factors as well.
Okay. Yeah. Wow. That's interesting. It means that those are the things that cause some persons to have stronger body odor than others. Right?
But I would not say it's not entirely so, because if you're not practicing good hygiene, you're going to have strong body odor. Because the entire reason why bronchitis comes is when, I'm speaking about from sweat coming out. So bronchitis is body odor, right? And there are various types or causes of bronchitis.
Okay.
So we have we have apocrine, we have eccrine. Let me explain. So we know we have sweat glands in our bodies, right? And there are various types of sweat glands. There's sweat gland that is to regulate our body temperature. Like if you feel very warm now in your body, right? There's a particular sweat gland called eccrine, right? That will be stimulated or activated, and it's now cause you to sweat and the sweat to evaporate. You notice that when you sweat and sweat evaporates, that place feels cooler. That's the function of eccrine and sweat glands.
Oh.
That's one type. There's another type of sweat glands called apocrine.
Okay.
That one is in specific places like the armpits, the genital area, right? That one is activated by senses like fear, sexual arousal, anxiety, and all of that.
Seriously?
Yes. Now, normally, when those sweats are released from those glands, right, they are odorless. However, if the sweat comes in contact with skin bacteria or other kinds of bacteria, the bacteria will break down the sweat, and then that will now emit an unpleasant smell. So that also goes on to say that if someone has a skin infection, it means that person gets to have more bacteria in the person's skin. So you see that someone that has skin infection and is sweating, you will have a stronger body odor.
It's a serious matter, doctor. It's a very serious matter. And we've had problems in marriages, especially the genital area, where, sometimes the husband is not able to tell the woman that, see, madam, you need to work on the upspace.
Another thing, everybody mentioned this because people don't understand that taking off hair is essential
tell me about it.
in doing away with bronchitis. Because the hair is there trapping all the bacteria and all of that. So the reason why there's malodor is because bacteria is missing the sweat. So taking out hair in the armpits and genital area is very important.
Okay. Wow. So we're going to go on a short break and we'll be right back to talk about psychology and the social and emotional impact of body odor. Thank you.
Thank you.